Now, what is the algorithm? First, whenever a patient is presenting to you with an upper airway obstruction, a quick history and physical examination should be done. Now, when you do a quick history and physical examination, you will understand, is there a gradual onset symptoms and mild symptoms, or a sudden onset symptoms with severe symptoms and the patient is having an impending respiratory failure. So, if the patient is having an impending respiratory failure, you have to have an urgent establishment of the airway, because that is critical for the patient. So you must urgently establish an airway so that the airway is secured. We know the lines of emergency, the airway, breathing and circulation. So airway has to be secured. Now, is endotracheal intubation possible? Yes, do endotracheal intubation directly or fiber optic awake intubation, depending on the patient. You can make a choice. If the endotracheal intubation is not a possibility, no, then what do? We do a cricothyroidotomy or a tracheostomy, depending upon where is the obstruction and how much time the patient is giving us. So if the patient is having impending failure or is having severe obstruction, try to intubate. If intubation is possible, do direct or fiber optic intubation. Not possible, cricothyroidotomy or a tracheostomy. Now, if a patient is coming to you with a gradual onset symptoms, then what will you do? You will have to do investigations like bronchoscopy, upper airway evaluation and spirometry to understand what is the level of obstruction, what is the cause of obstruction, where is it lying, how do we evaluate, how do we treat, has to be identified. So investigating becomes very important to identify what is the cause. So gradual onset, mild symptoms, you have to just investigate.